We now return to a town hall meeting, States of Addiction, Fighting the Opioid Epidemic.
Welcome back to a special edition of 13 News at 7. Of course, tonight we've been talking about the opioid crisis and what it's done to our region. But the good news tonight is that there is hope. There are lots of different treatment options out there. And now we want to talk to our panelists. Each of you kind of come from a different angle, and you see different types of addiction and how people are dealing with it and being treated. And JD, you have worked with a program for several years now in Charleston, Celebrate Recovery at River Ridge Church. Talk to me about the treatment there and your views on recovery and the success that you all are seeing.
Well, when I came into the program 11 years ago, I came in with no hope. I figured I've been this way my whole life, and I've tried to quit, and I can't. Mm-hmm. But when I came in, that's what I heard at the first Celebrate Recovery meeting I went to was, hey, there's hope. And I heard other people who had problems, and then now we're getting better. And so that instilled with me a sense of hope. And they kept saying, keep coming back, it works if you work it. And we're finding great success from a spiritual aspect, because a lot of our problems come from a need of being wanted, of being loved, and we just don't have that. Mm-hmm. And so when we come in, and when you come in to Celebrate Recovery as a newcomer, we welcome you, we celebrate you, we put our arms around you, we hug you, and we let you know that now you are part of a forever family. And that makes a big difference. And so sometimes I hear, okay, I'm in rehab, I get off the drug, then what? Mm-hmm. And we are one of the then what answers, because there was an emptiness or a hurt that made someone turn to drugs in the first place. Sure. Made me turn to something in the first place. And if that is not taken care of, then the chance of relapse is very, very strong. And so when somebody has a family they can belong to, they get away from their old friends who drag them down, mm-hmm. and have new friends who lift them up, and then turn them over to a higher power who there is more power than just by myself. By myself, when I'm by myself, I'm in bad company. Mm-hmm. But when I have friends and accountability, mm-hmm. things like that, then I'm able to get better and better and better and better. I don't have to go back, because the initial pain, the initial loneliness, mm-hmm. or depression is taken care of. Therefore, I don't need the drug, because I don't have the pain. And that's the key to this, and it's changed my life. And there's 30,000 Celebrate Recovery meetings this week.
And where can people, if you're watching this outside of the Charleston area, how can you find a recovery meeting? Just
go to celebraterecovery.com, mm-hmm. and click on Group Finder, and you'll find one of those 30,000 meetings across the country. When I'm on vacation, I go to that and find a meeting that I can go to while I'm away.
That's a great idea. You can take it with you. What were some of the recurring themes as you interviewed people throughout the state? Where were you seeing the most hope, John?
Well, you know, I really think the hope is with children and stopping the problem before it starts. Mm-hmm. I've founded a nonprofit called the Appalachian Arts Academy. And what we're trying to do is provide arts education scholarships to kids in areas affected by the opioid crisis. We're starting our first set of classes at the North Charleston Community Center. Mm-hmm. And what we're going to start with is film and acting classes for kids, and to try to get them involved and give them some inspiration, give them some hope. And you know, it's for the budding artists, but it's also for you know, kids that just want to have something to do, to mm-hmm. have something to you know, it gives them life skills. It gives them you know, gets them off the streets, and mm-hmm. that's what we're trying to do. And we're starting with film and acting, and we're expanding to music and dance and fashion, and you know, all kinds of different mediums. So
you let us know when you have a class on broadcast. We'll be there for broadcast journalism for these kids.
We'll have you in to teach.
And this is also something I know you are also trying to help parents, but also obviously help babies from a young age. So tell me about where you see the hope in the recovery and the treatment.
I see the hope in families that bring their babies back to visit us after they've gone home and they've been successful. So it can be done. It really can be done. It takes a lot of encouragement. It takes a lot of family support. It takes a lot of support from the community. And if I could say something to any mother out there who's pregnant and experiencing addiction, get help. And if you can't find help, you can call me and I will help you find help. And you can call me at Cabell Huntington Hospital, because I want you to have a healthy pregnancy so you can have a healthy baby. And I don't want you to be afraid. Don't be afraid to get help. Your baby's health depends on it, and your family and your future depends on it.
I love that. Don't be afraid to call. And from the emergency room standpoint, what are your thoughts on our treatment options out there and the hope for these folks?
Well, to begin with, I think we need to remember that, like I said before, that each one of these people, no matter how they became addicted, whether it be a fault of their own or something that they just kind of happened in their life, they're still a person and they need treatment. We will be there in the emergency rooms 24/7 if it means giving them Narcan 15 times, and the 15th time they wake up, see someone standing there, maybe the same nurse that's been in their room 5 times before, that can say, we're here, we can get you connected with someone who can help you. That follows the mission of St. Mary's. It's very important to the St. Mary's mission and to the Palatine Sisters that we treat everyone with dignity and we take care of them with dignity.
Brad?
There are several types of treatment, and people will argue one's better than the other. Well, I tried that, didn't work. I tried this, didn't work, and now I'm here. There's different types of treatment at various levels of care based on the severity of somebody's opiate use disorder. And despite the differences, there's one thing that they all have in common, is that a person has to implement I'm talking core changes to experience freedom from addiction. Whether it's outpatient, medication-assisted treatment, residential, it doesn't matter. A person is going to have to make the same changes regardless of the level of care or the type of treatment.
That's right.
And Tim?
I get up every morning and I say to myself, prevention works, treatment is effective, and people do recover. This right here is an example of that. If you could see his picture several years ago when he was in active addiction, and then look at him now. I get to see every day fathers being reunited with their wives, children reunited with parents, people getting a job, getting that license. We have a gentleman right now that's got a full scholarship going back to Marshall that 5 years ago was out here on our streets in active addiction.
Wow.
We have to understand that recovery, treatment and recovery is out there. It's available, and as we said, there's no silver bullet, but there's silver buckshot. We have to look at it in every area. Part of my hope is you all taking the message back to your home, sitting down and talking to your children, not giving up. We talked earlier, we want to merge concern with hope. And I hope tonight, and as a result of this, we have a greater sense of hope for each other, for our communities, and certainly for our state.
We certainly hope that too. We want to echo that. And really quickly, Patrick, I know you have a quick question as well.
Tim, a quick question for you probably. There are a lot of people out there between a rock and a hard place. Addicted, they can't get a job because they can't pass the drug test, right? So they find themselves in a world of, where do I go? What do you tell them tonight?
First of all, call the number, the 844-HELP-for-WV. I'm very excited to tell you that West Virginia also passed the second chance legislation that allows someone who may have lost their license or have fines because of driving without insurance or license to get those things back and pay for those. The other thing is this: don't give up on hope. Don't give up on yourself. All of us on this, I think the other thing is we're all working together. We're moved outside our silos. And that's the thing, from the hospital to connection with Prestera, from Prestera to recovery, from recovery then to celebrate recovery. Having that opportunity to walk people through the process.
And we're going to talk more about where you can get help if you or someone you know needs it when we come back. Stay with us.
If you need, don't be ashamed to ask for help. There are so many programs out there. There's always hope to get better. If someone like me can do it, and like I said, I've been using different drugs since I was 11. and I know I'm in a good spot.
We will return to a town hall meeting, States of Addiction, Fighting the Opioid Epidemic.